Hi, good evening, everyone. I'm Dr. Nandini, and it's a pleasure to be here today. So this is a slightly different webinar that we are holding today. I won't be talking too much. I will be just giving a brief overview of the most recent treatments available and what we have put together as a program for. I'll be focusing more on autism and cerebral palsy, but holds true for other neurological conditions also. I'm going to keep my presentation brief, and I would like to give time to all of you to ask any question that you may have. Consider this to be like a virtual consultation. I would request you all to keep your questions ready, and you can put the questions in the question answer section. I think there is a question answer section. If not, you can put it in the chat section. So once I finish my brief presentation, I will be answering the questions that you put in, any doubts, questions, queries that you may have about the treatment. I'd be happy to answer. So be ready with all your questions. I'm going to briefly talk about the recent advances in the medical management of autism and cerebral palsy. Uh, and I'm Dr. Nandini Chandran. I'm Deputy Director as well as Consultant Regenerative Medicine of NeuroGen Brain and Spine Institute, which is in Navi Mumbai, India. So this talk is for information purpose only. This is not purely a medical consultation, but we will be doing almost like an online question answer session. We are here because either we are parents of children with uh, uh, autism or cerebral palsy or different developmental conditions or neurological conditions, or caretakers or stakeholders such as either therapists or doctors. So, what are we here going to talk about? We are going to talk about a holistic, comprehensive, multidisciplinary treatment approach to neurodevelopmental conditions with focus on autism and cerebral palsy. So, what NeuroGen has brought through over last 16 years of experience um, is a comprehensive treatment plan, a holistic, or we call it as a 360-degree treatment plan. Now, the peg or the main base of this treatment is, of course, cellular therapy or cell therapy or neuroregenerative therapy. But along with that is a comprehensive rehabilitation program. And in addition, the last 5 years, we have added oxygen-based integrative therapies, as well as we keep on adding other treatments like gut cleansing treatments and also nutrient supplementation based on logical, rational blood workup. So I'm going to talk about the whole comprehensive approach in a stepwise manner. So till now, we were told that central nervous system, once damaged, is incapable of regeneration. However, over the last 16 years and even before that, a lot of research has happened which shows that there is possibility of regeneration. It may not be as much as other organs like liver or skin or bone, but brain does have capacity to regenerate, and it is helped through the process of cellular replacement and repair. So, at NeuroGen, what is the process that we use in the process of regenerative medicine? What we are using is autologous bone marrow derived mononuclear cells. I will be explaining shortly about it. So, cells taken from the patient's own body and processed and injected back into the patient's own body through a spinal fluid, into the spinal fluid. So, what are we using as a source of cells or tissue repair? These are autologous bone marrow derived mononuclear cells. So, what is bone marrow? Bone marrow is the place where blood is formed every minute, every day, every week, every hour of our life till we are alive. So, the bone marrow is a factory of blood, and it contains stem cells which keep on reviving themselves, as well as at the same time forming the components of the blood. So we have two parts in a bone marrow: cells which are on the way to form new blood cells, and those cells which are multiplying and forming or cloning themselves, and they are the basic stem cells. So we are taking that replenishable source in our body to repair our own body. That's why autologous bone marrow derived mononuclear cells. And why do we use it? Because they are safe. Okay, they have never been seen to form any tumors or any cancers, as opposed to the other cells that we take from outside. They are non-tumorigenic. It has no rejection potential, um, and that because the cells are from the patient's own body, there is no rejection. The body accepts the patient's body cells, easily obtainable. There is no surgery. There is no big process. It is one needle in the hip bone in the front and one needle in the lower back. There are no ethical issues because we are not killing an embryo as happens in an embryonic stem cells. We are using the patient's own cells and hence no ethical issues. So what does this bone marrow cell component that we take, what kind of cells do they contain? They contain a cocktail of cells. They contain heterogeneous cell population. So different type of cells, they become a team. And this team is what helps the brain to repair. So what does the team primarily have? Hematopoietic stem cells, cells which are forming blood type of cells, mesenchymal stem cells, a few of them, endothelial progenitor cells, which form blood vessels, and very small embryonic-like stem cells, which can form brain cells. So you have all these different components, and each of them have differing action. They have different strengths, and together the bond or the team that they form is very strong. So here we are not banking on one type of cell. We have different types of cells having differing action, all together helping promote the regenerative capacity of this cocktail of cells. Okay, so cumulative effect. So a team is better than an individual, isn't it? So once the cells are separated, what do we do? Where do we inject them? We are injecting them, you can see here, into the spinal fluid lower down. So this is the brain, okay, and this is the spinal cord here, but you have this bone, that is the vertebra, that is a fortress along the spinal cord. And at one point here, at L1, the spinal cord ends. You can see ends, and only nerves are coming out. So injecting or transplanting the cells here, where there is a fluid which goes all around the vein and spine, and these cells will go to the parts which are damaged or inflamed via this cerebrospinal fluid. So now why intrathecal? Okay, so let us look at, if I want to reach the brain, because we are talking about brain conditions, I'm going to use the brain as my target. I want the cells to reach the brain. Okay. If I want the cells to reach the brain, what is the most simple way of putting the cells in our body? That is through the intravenous route. Okay. So we can put the cells IV, like you would put a drip. Okay. Now, when you put the cells IV, the cells, what is the route they go through? They go through the blood and they reach the right side of the heart. The right side of the heart pumps it to the lungs. Now, the lungs is the filtration unit of our body for the blood and oxygen. So as it takes in the oxygen and sends out the carbon dioxide, it also filters almost 50% of the cells that we may have put in the IV. So here we have lost 50%. Okay, the other 50% which have been able to cross through the lungs, through the alveoli, will finally reach the left side of the heart. And from this left side of the heart, three main branches or arteries will push these cells to all parts of our body. Because the heart is the source of blood for all parts of our body. So it goes to all parts. So wherever there is inflammation, wherever there is damage, now the cells will go everywhere. Suppose we assume that 10 to 15 or 20% of these cells have somehow been able to reach near the brain. But have we been able to reach into the brain? Because the brain now contains this or is surrounded or protected by three covers to prevent unwanted things reaching the brain. So to cross this blood-brain barrier is another issue. So finally, you understand, you may start with 100 cells, land up with the brain seeing only maybe 5 or 10. So here the efficiency really goes down. So though intravenous transfusion is the simplest, may have limited or no side effects, also the efficiency is low. So that is one end of the spectrum, or one end of what we can do. The other end is we can go directly into the brain. So that's called stereotactic way of injection. You can go directly, you can directly inject the cells where they are needed. But the efficiency theoretically may be really high. But what are we doing here? We are going into the brain. We may go through part of the brain which is normal. So we may end up injuring the normal tissue in the brain. And at the same time, it is a morbid procedure, especially for a child, and may cause other complications. So high in risk, high in efficiency. So we have on one side low risk, low efficiency intravenous infusion. The other side, high risk, high efficiency stereotactic injection. So what we have tried to do is find a middle path. So that's why inject the cells into the spinal fluid. So it's just one needle. You're not going into the brain. You're not touching the brain or the spine tissue. You're going into the space where there is a fluid which goes all around the brain. So you are leaving the cells there. The other thing is you're crossing the two barriers out of three. So this is called subarachnoid space. So it crosses the dura mater and the arachnoid mater. And what remains to be crossed is a very, very thin layer which is attached to the brain and spine. And that's the pia mater. It's porous and the cells are able to reach the brain much more efficiently than you would expect in an intravenous. So simple, no cuts, no surgeries, minimal or no risk of injuring the central nervous system, with a higher efficiency rate of directly going to the brain, not getting, diluted into the liver or the lungs or the heart. It either goes to the brain or it goes to the spine. So minimally invasive, safe, no major side effects, homing of the cells into the damaged tissue, wherever the brain has damage, either because of hypoxia or if there is inflammation, they release chemotactic agents or chemicals which will attract the cells towards them so that that part can be healed. No dilution into other organs like lungs, liver, or spleen. So this is the step. You take the bone marrow from the hip bone. I will try to show you where from the hip bone. So the patient is sleeping straight with the face up. So from the front, in the hip, if you touch the front part of the hip, you feel a bone, and that's where the bone marrow is aspirated. Very, very thin needle. The bone marrow is like thick blood. That is about 10 to 15 minutes. Then there is a separation in the laboratory. You can see the red bone marrow will undergo centrifugation, and what we need will come as a different layer of a white buffy coat which contains millions of cells, separated, purified again, and injected in by a very thin needle in the lower back. So that is the process. So let's see the video. Sleeping, face up, sleeping, separation, and injection. So that is one part of our treatment. The other part, of course, as I said, comprehensive rehabilitation under one roof. Neurorehabilitation is very important. The treatment is a teamwork between cellular therapy and neurorehabilitation. Together, it makes a very strong bond. So teamwork, again, very important, is I would say the USP of our treatment. Not only the bone marrow has a teamwork, but the bone marrow cells regenerating the brain along with neuro rehabilitation is another teamwork, which is very, very important. So we have, of course, you have the clinicians, you have the nursing staff, but you have physiotherapists and occupational therapists and speech therapists and psychologists and aquatic therapists and nutritionists and special educator. And so you have the complete range of rehabilitation under one roof. So different therapists have different role. It may seem to clash or overlap, but each one looks at the child in their way so that together we do not miss any of the child's issues. So this is a comprehensive rehab. You have here psychologists talking to the child and as well as the parents, and you have occupational therapy, you have art-based therapy, you have the psychologist working on cognitive training, you have your sensory integration therapy, physiotherapist work both with cerebral palsy as well as children with autism. So that's a part, and aquatic therapy, that's a part of the integrative rehabilitation program. The integrative therapies or oxygen-based therapy, I'll try explain a little bit more in detail because parents want to know more about this. Hyperbaric oxygen therapy, ozone therapy, gut cleansing through ozone and medical treatment, acupressure and deep tissue mobilization, vitamin and micronutrient therapy. So hyperbaric oxygen therapy, what does it do? So this is a chamber where the child will go in with the parent. This chamber will be slowly infused with 100% oxygen at increasing pressure. Now, right now, what we are breathing is 20% oxygen at 1 atmosphere pressure. What happens in such a condition? If you see what happens in the blood, oxygen goes into the blood. Where does it go into the blood? It doesn't go into the fluid medium when we are breathing. It goes into the red blood cells. It attaches itself to the hemoglobin, and only the hemoglobin is able to carry this oxygen. And when it goes to the lungs, it gets transfused into the exchanged and goes into the artery. So from the vein, now it's going to the artery. Now, this oxygen in the red blood cells is currently limited. And even if you go give 100% oxygen you breathe, our blood is going to be infused because it gets saturated into the RBCs. You will not find the oxygen in the other parts. But in the hyperbaric condition, hyper is increase, bara is pressure, and increased pressure and concentration, you will see more oxygen. Here you see the difference. It's into the bloodstream, into the plasma. So when the oxygen is diffused into the plasma, it can go to nooks and corners of the brain, of the skin, of the heart, of the liver. Here we are interested in the brain mostly. So it will go to corner places where even the blood cells cannot go, because after some time the artery will, divide, become very, very thin capillaries where only the plasma can go. But now the plasma is infused or diffused completely with oxygen. So now oxygen can go into small, small places. So that's what the hyperbaric oxygen does. So that pressure has to increase slowly. On one day we will give 1.3, the next day we'll do 1.4, the third day we'll do 1.5, and based on the age of the child and the weight of the child, we may go maximum up till 1.8 atmosphere pressure. So that's where between 1.5 and 1.8, you will get the maximum impact of this treatment. Okay, so it involves breathing pure oxygen, improved oxygenation throughout the body, including the brain, and acts as an adjuvant therapy, increases homing and engraftment of the stem cells, making the therapeutic effect better. Okay, so these are different publications. One on the effect of mesenchymal stem cell transplantation along with hyperbaric oxygen in a spinal cord injury rat model. Then stem cell is mobilized by hyperbaric oxygen. Hyperbaric oxygen also increases the stem cell proliferation, leading to better blood supply and wound healing in diabetic mice. So the combination of cell therapy and hyperbaric has a lot of advantages. So it stimulates oxygenation, strengthens immunity, improves brain functioning, improves metabolism, energy levels are increased, reduces fatigue, overall functioning is improved. Okay, that was about hyperbaric oxygen. Now I'll go to ozone therapy. Now, what is ozone? Ozone is O2, that is medical oxygen in a cylinder, converted into O3 oxygen. So this is here you can see is the ozonator. So the oxygen will go in through this blue pipe, and here the machine will collide this two O2 in together and give us a O3, which comes out from another outlet. Okay, and then it can be either given as a sauna. Here you can see the sauna, or it can be given through oil in nose. In children, we give it as give it as a rectal enema, like an enema. We can give it into the ear through the stethoscope, or we can do a ozone cupping on the face to improve the oromotor for chewing and speech. So it's an adjuvant therapy again. So standalone, it has limited effect, but it's usually complements the other treatments that you may be giving. It complements the cellular therapy when you do it in controlled concentration, everything in the right dosage. It acts as an anti-stress response, so not just a psychological stress, but the cellular stress. So many children have mitochondrial dysfunction. Both HBOT as well as ozone helps in reducing the mitochondrial dysfunction by increasing the respiratory capacity of the cell. So cell is able to breathe better because the stress or pressure on it is reduced. It helps the cells to survive better, differentiate and divide better. That's for the stem cells. However, as you can see O2, two strong bonds here, but the third O is very, very delicate. So it's an activated oxygen, and when it goes into the body, it acts as a natural germicidal. It kills unwanted viruses, bacteria, and fungal. It reduces inflammation and swelling. It reduces the blood clots. It acts as an antioxidant. It reduces inflammation in the body, in the gut, and in the brain, improves the gut health. It detoxes the liver because finally the ozone from the rectum goes to the liver. It helps to detoxify the body. So a lot of good effects. Gut cleansing in children primarily through the ozone therapy. It helps the gut cleanse, but we also do medical cleansing post the gut microbiome test. So I'll be talking a little bit about gut microbiome when I talk about autism. So this is a stool test which lets us know what is wrong in the gut of the child. So medical treatment in a phase-wise manner helps to cleanse the issues in the gut. So ozone is one way. The other way is the medical management. The third thing that we are doing is acupressure or deep tissue mobilization, which at pressure at different points helps the muscles to relax. The child calms down. Children love this. Initially they resist, but later they love this. Of course, diet and nutrition advice is important. This is a little generic, but specifically for each child, there would be a diet plan given. Uh, in principle, avoid sugars, additives, pesticides, a lot of junk food, hard to digest starches, give more of roughage. You can try camel milk, which is fresh, curcumin as an antioxidant. Fermented food are very good. Gluten-free, casein-free diet depends on you. Now, vitamin IV and oral, IV not in children. In children, it is more oral. Generally, in a pediatric population, intravenous vitamins are not recommended, but oral can be because they can be monitored and adjusted. Okay, so it all depends. Not everything is given to everybody. It all depends on the blood workup that we do. And depending on the need of the child, the vitamin therapy will be modified. So we do tests for B2, B6, B9, so pyridoxine, riboflavin, folic acid, homocysteine, cobalamin, that is B12, and vitamin D, and look at how much is affected. We do not give a lot of omega-3 or carnitine because sometimes it overstimulates the brain, but depending on what the child requires, the supplements would be modified. And I will talk a little bit more again when I come to autism. Now, what is the scientific basis of our work? 111 publications in the last 16 years in different topics, autism 17, cerebral palsy 15, and most of so these are all scientific publications in national and international peer-reviewed journal. Please do look at them. All of them are available on our website. So what are the conditions that we treat briefly? Pediatrics, autism, cerebral palsy, intellectual disability, muscular dystrophy, spinal cord injury, stroke, traumatic brain injury, motor neuron, dementia, and other incurable neurological conditions. So what is we have the operation theater. This is where the procedure happens. And from here through a pass box, the cells go to the laboratory where it is processed within a few hours. Cells are separated and this is all the same complex. And this is where the patient stays. These are all the books that we have written for professionals and caretakers and all available freely downloadable on our website. Do have a look at them. The book chapters that we have been part of. Okay. Now, what do you do in autism? What are our results? First, let us understand autism first. So we are looking at autism not as a like a two-dimensional thing. We are looking at autism as a whole. So we will look at the brain, we will look in the blood, we'll look at how the blood is affected by genetic factors, the blood nutrients, and we look at the gut. Okay. So neuroimaging finding, MRI and PET scan. The MRI tells us about functioning of the brain, and PET scan tells us, sorry, MRI tells about structure of the brain, and PET scan tells us about functioning of the brain. Biochemical findings in the blood we'll discuss, and CSF we will discuss, and genetic findings, how are they impacting the nutrients in the child's blood and how it is being utilized, and of course the gut issues or gut dysbiosis. So neuroimaging, PET scan, when you look at the PET scan, this is a functional scan which tells us which parts of the brain are functioning, how much. So when you see the brain from the side view, the green, yellow, and red are good functioning brain. The blue here is functioning less. Darker the blue, lesser the functioning. Generally, these are the areas that you see are functioning less. So what do you see here? This is the area, small area known as medial temporal. This is for understanding, learning, comprehension, socialization, emotional expression. Here that you see, if you see my cursor, this is the thalamus for sensory and motor processing. And here, if you see the small brain in the back, the cerebellum for fine motor activity, coordination, balance, and articulation. So this is a study that we have done and published in the World Journal of Nuclear Medicine. The gist of the study is this. When you look at the brain of neurotypical children, when the child grows, the brain functions as a blue line increases with age. So from 0 to 10, the brain functioning is increasing faster. Between 10 years to 15 years, it is increasing but slower. However, in children with autism, initially the brain functioning may be high, but it goes down with time. And you can see at one point there is a crossover, and as the age increases, the gap increases. That's why intervention before 5 years seems to be giving us the best chance because the gap is less. Okay. So this is an MRI study. Generally, when you do MRI is broadly normal. However, we went more in depth. Our research team did a very deep study and found that the connections in the brain, or the corpus callosum, the connecting part of two parts of the brain, is thinner than in neurotypical. So this is one half of the brain, the other half, they work with each other through this part or a bridge known as the corpus callosum. And this bridge is smaller in children with autism as compared to neurotypical. That's why they don't have good coordination between the right and left brain. Okay. The third thing is the biochemical findings. So as we said, mitochondria is a powerhouse, the respiratory system, the energy producing unit of the cell. Okay. And this is many a times not functioning very well in children with autism, leading to abnormal brain functioning and abnormalities seen in autism children. In what we see, what could be the possible reason, the nutrients that folic acid, which needs to be converted to an activated methylfolate, is not happening. Now, what is folic acid? It is vitamin B9. When we eat food, maybe a lot of non-veg food, you get B9 and B12, but these are in inactive form, and now the body has to convert it into a activated form, that is methylfolate. It has to be methylated, but sometimes because of various issues like gene not functioning appropriately, the MTHF gene not functioning properly, MTHFR gene mutation may lead or prevent the methylfolate from being formed. So you can see that the active usable form is not formed, and that may lead to a impairment in the mitochondrial function, as well as the impairment in the synthesis of the DNA, repair of the cell, formation of neurotransmitters like melatonin. I think most parents will understand melatonin better, because you have to give melatonin to your child because the child doesn't sleep. And why do you have to give melatonin? Because the brain is not producing melatonin. Okay, other transmitters, the neurotransmitters are serotonin. Okay, these neurotransmitters are important for mood stabilization and for motivation and for the child to be want to do something. Usually, you have to force your child to play with other children or even engage in play activities or speak. So all that is because of serotonin not being formed properly. So the raw material, one of the major raw material is the methyl folate. So that's where is one of the problems. So we looked at the MTHFR data. We keep testing them, and we this is a data of 1,002 patients that we have treated. The mutation, MTHFR mutation, it can be two common places. This two common spelling mistakes. So what is a mutation? For example, my name is Nandini, Nandini. Okay, my spelling, my name, some people misspell as Nandeni. That's all right. It's not changing the meaning of the name. But suppose there is a spelling mistake, instead of N-A-N, it is N-N-D-I-N-I, then that is completely wrong. So these spelling mistake which change the name completely are the problematic ones. So most common spelling mistake in the MTHFR gene is this: A to C. So the amino acid that is A gets replaced with C. So that makes a major problem in the spelling of the MTHFR gene, and C to T in this particular position of the gene. So these are common. There are other MTHFR gene mutations also, but they are uncommon and they have to be picked up by a more detailed test. So in this current test that we have implemented, these are the gene mutation that we are checking, and we find that about this gene mutation is present in 73% of the children that we have checked, and 26% do not have either of these mutations. Okay. Now, this mutation can be in one gene coming from either mother or father, or it can be in both. If it's in one gene, it is heterozygous. If it is coming from both parents, it is homozygous. So definitely the functioning of this gene will be more affected when there is a homozygous mutation. So in heterozygous, it is partially affected. So all of these are may lead to either a very high level of folic acid in the blood, or it can lead to very low folic acid. So in both these conditions, the folic acid is not efficiently working. So we have to supplement with a activated form that is known as L-methyl folate, or now we are giving it as syrup, that is quaterfolate or ortina. Apart from that, we are still reviewing our data about amino acids and neurotransmitters which regulate the mood of the child, the behavior and brain function. So there are some neurotransmitters in the brain which, if they increase, they cause anxiety and sensory issue, that is glutamate. If GABA can be low or high, if GABA is low, it is a controlling neurotransmitter. It prevents hyperactivity. So if GABA is low, there will be poor impulse control and hyperactivity will be more. If dopamine is low, the child will have repetitive behavior and poor focus. If norepinephrine or noradrenaline are low, it causes poor attention and again low motivation. So we are checking this and we find that glutamate is very high. In autism, GABA is low, serotonin is low, dopamine is low. So we are still analyzing what is the difference in the blood, in the urine, in the CSF. Once we analyze this and find some pattern, then we will be able to treat it better. So why I'm saying this? Because we have to first understand before supplementing. Many a times biomedical doctors and many people, I know there is a lot of discussion in the groups that give GABA, give methionine, SAMI, give everything. But without understanding, if you give randomly, you will not know really what's happening inside your child. The child is unable to tell you. Every supplement, every medication that you give works differently in every child. So it has to be done slowly, rationally, with lot of thought, so that if something goes wrong, you can course correct. Okay. I'm not going to go too much in detail. It's quite too technical and scientific. So genetics, we have told you that there is MTHFR gene mutation testing done where we do see that 73% or around almost 80% of these individuals have the mutation. Okay. Gut, very important. So everybody talks about gut-brain axis, right? Gut-brain axis. But there is a brain-gut axis also. So it starts with the brain and it affects the gut. So when the brain functioning is low, the gut motility, movement of the gut is slower. And when movement of the gut is slower, then the food gets accumulated in the, it remains there. The child has constipation, has gas, even we do that. So when it remains there, it helps the gut absorb more of toxic elements in the fecal matter, which needs to actually, go out of your body. And nutrition doesn't get absorbed properly. And that leads to the gut affecting the brain by release of toxic chemicals. Okay. So how do we work on this? So we have to cut or to work on the problem at two different levels. One is at the brain level. So that's where we are doing the cell therapy to repair the brain. But in the meantime, all these years, the gut has been such a big problem. We also need to clean the gut. And that's where comes the looking at the gut dysbiosis. So 70% of autism individuals have severe gut issue linked to digestive problem, behavior problem, immune dysfunction, and neurotransmitter imbalance, because gut also produces neurotransmitter. Gut is the second nervous system in our body, has a lot of nerves there. Okay, so when we looked at 1,000 stool samples. So the sample is very simple. You take a stool sample, you send it to a company, which gives you a very detailed assessment of what is happening in the gut of the child. So what did we find? We found that 47% of these children had infection with E. coli bacteria, and 59% had infection with Shigella dysentery. So they may not have any symptoms of loose motion or anything, but it is there in the gut and it is causing problem. Okay, this needs to be treated. Okay, then fungal, 27% had Candida species and 11% has Aspergillus niger. Aspergillus niger is a very difficult fungus to get rid of. So that's why sometimes we have to do multiple times treatment of the gut with antifungal agents. So this needs to be taken care of. Then 39% of children had protozoal infection or cryptosporidium. So all these, what does this lead to? It leads to stereotypical behavior, social communication disorder. Shigella causes neurological symptoms like seizures and drowsiness, behavioral symptoms like aggressiveness, stimming, laughing without reason, candida, fungus, very big issue. Aspergillus infection causes social communication and interaction issues. Cryptosporidium, of course, causes stomach cramps and diarrhea and nausea. So we have to treat that, right? So that was about the 360-degree approach, and that's what we do in NeuroGen. Now let's look at some of the data that has come from NeuroGen. The first ever publication, first ever scientific publication in the world came from NeuroGen. People say there is no proof, there is no proof. Look at the proof. In 2013, we published the first publication with 32 children, data of 32 children. The second one came in 2020. Okay, I'm sorry it is not here, but this is the third one. This is the recent one which has been recently accepted for publication in clinical transplantation and research on data of 1,011 autism children on the spectrum. And I believe that there is no other study which has such a big cohort. And let us see what this says. So 1,011 patients, where the same process I've already explained, with the mean follow-up of 19 months. So it's not 2-3 months, it's 19 months. And we have done clinical assessment, we have done PET scan and looked at the data. Okay. So symptomatic improvement that we see 82% of children improve in attention concentration, 80% improve in command following, 78% improve in eye contact, 70% sitting tolerance, 65% in social interaction, 65% hyperactivity reduces, 61% communication becomes better, 60% speech improves, stereotypical behavior reduction in 53% of children, aggressiveness reduced in 50%, self-injurious behavior reduced in 49%. Okay, this is the improvement that we see. Now, when we look at outcome measures like Indian Scale for Autism Assessment and the Childhood Autism Rating Scale, which tells it about severity of autism, the percentage improvement is seen in 85% of the children. Okay. Different domains of the Indian Scale for Autism Assessment, improvement in all these different domains is statistically significant. Okay. Now, when we look at age-wise percentage, children between 0 to 5 years, 89% show improvement. In 5 to 10%, 87, 10 to 15, 85, and above 15 years, 74 to 80%. So this is the general analysis. But when we look at repeated treatment, some people say why second and why third, this graph actually gives us that readout. When you do one treatment, on an average, 71% of these children show improvement. When we do two treatment, this jumps to 96 and 97%. And when we do more than two treatments, it goes to 99%. So those patients who have taken two treatment, out of them, 96 to 97% are showing improvement. Those who have taken three treatments, 99% of these children show improvement. So that's why number of treatment, it has a impact which lasts for a longer time. Now, when we look at age-wise analysis with the number of treatments, again, 0 to 5 years, one treatment, 77%, but with the second and third treatment, you continue to get improvement in all the children. So 100% of these children improve when you do a second and third treatment. Between 5 to 10 years, first treatment, 75% of the children improved. With the second treatment, 96% of those who have taken the second treatment improved. And with the third treatment, 100%, we reached 100%. 10 to 15 years, it goes up a little. 63% in the first treatment, 196 to 100 in the second and third. Similarly, for 15 and above, so 60% to 100, it goes if you do repeated treatments. Again, this is the ISA score. So these are different clinical methods that we have looked at. And when we looked at PET scan, we have analyzed 400 patients out of those who are treated, and we saw that the patients improved in their brain activity in different regions. So when you do the PET scan, this green yellow is good functioning brain. This is before the treatment. The blue area is functioning less. 1, 2, 3. Right? So you can see the cerebellum improve after the treatment. You can see green means better functioning brain. Here again, green thalamus improved, understanding area improved. Okay, you can see here before, you can see now. Before, now. Before thalamus, now. Right? So that's about autism. And when we combine autism with oxygen-based therapy, we also looked at, what is the difference. So we are almost 700 in each group. One group had cell therapy and rehab, the other had cell therapy, rehab and integrative therapy. And when we look at it, what do we find? That when you do only cell therapy, so many patients improve. Out of 714, 627, and with integrative, out of 732, 671. What is the percentage? So in different symptoms, social interaction improved, you can see 56 to 63. So 4 plus 3, 9% almost better improvement when you add oxygen-based therapies. Eye contact, again, 8% better improvement, 6% better in attention concentration, 4% more in reduction of stereotypical behavior. Let's see in speech, almost 6% better improvement. Communication, 2 plus 9, 11% better improvement in communication when you add oxygen-based therapies. Okay. Again, when you look that, you can see ISA score, the clinical scores are better when you do that. And also we see that when we look at the PET scan before and after, and we compare the two cohorts, that better SUV uptake and better uptake of the diet, showing better metabolism in the brain when you add integrative therapies. Okay, so this is a lot of technical thing. That was the gist of it. So when you look at the same thing in cerebral palsy, so this is when you combine cell therapy and hyperbaric oxygen in cerebral palsy, the gross motor function measured, GMFM, with only cell therapy improves by 88%. When you combine hyperbaric oxygen, improves by 92%. So almost 4% better impact, even in cerebral palsy when you combine oxygen-based therapies. So this is all the scientific publication on autism. And these are, if you see, the first came from India, second from China, third from Italy, fourth from US, fifth from US, sixth from India, again ours, seventh from Vietnam, eighth from Iran, ninth from US, 10th from Vietnam, 11th again from NeuroGen from India. So 3 of these are from India, from NeuroGen. one example of a very sweet young doll whom we've been treating for the last few years and how she has improved. This child is from Kenya, and just see what the mother says.
Eliana has something unique that we need to note. Because whatever she had in her mind, I believe Eliana one day will happen. Eliana is a gift from God. My name is Jane. I'm a mother of 3.
Eliana was born as a normal child.
At around 1 year, she had speech. But at around 1.5, she went mute. Never seen no talk, then grace.
When we went to the doctor, that's when the doctor realized the girl didn't have eye contact, couldn't respond to her name, and also the issue of speech. The doctor told us to start therapies. We tried engaging her. We reduced screen time. For close to 1 year, we did all that. It didn't work.
Every time I would go to room, I would see symptoms of autism. Some of the kids tiptoes. I would see it with my girl. But the doctor took me that journey to understand what autism is. When I was told about the diagnosis, first I saw the end of me. I couldn't handle it. How am I going to handle her? I'll handle her, she is dependent. I'll do everything. What about when I'm not there? What will happen? It was not easy. I was very down. I used to cry.
But he told us there's a solution, which is all about stem cell.
I was afraid. I mean, you're talking about the brain. Now you're sending me to India. My girl is going to be operated, or what will happen?
Told him our decision. He was very happy about it. When our journey started to NeuroGen for stem cell. Dr. Sharma is a special doctor who is interactive. For example, when you do stem cell therapy, he comes to your room personally to follow up, check the progress of the child, and also explain to you how stem cell works.
Dr. Arok, he told me, this girl in 2 years' time, she'll be totally a different girl. Believe me. That hope, the hope that they give us parents who are hopeless, who have seen the end of the world. When I did stem cell, things changed. Eliana's first improvement was speech.
After the first shot, the first one, Eliana said after stem cell, I think the second day, Daddy.
Daddy?
Which was very emotional to us.
Immediately after the first shot of stem cell, that's when she started now having one. Is it that? Tick. When we came here to NeuroGen, she was 3 years old, totally non-verbal. She had no speech.
Good job. Good job. You? Good job. Good job, Eliana. Good job.
She started responding to her name. Now you can call Eliana. Yes, she'll turn.
Is Eliana happy?
No.
Eliana is laughing.
Yeah. I remember the first day she called me mom, I cried. I cried because it was so emotional. My girl finally, she had speech.
And do you go to school?
I'm not going to school.
Eliana went back to school. The teachers, what did you do to her? She's different. She's calm. She started babbling. That same for few words here. Yeah. She's always the best in class, competing with the other normal children. That's why we decided to do the second shot. We have various therapies at NeuroGen, including aquatic, which more or less about water. We have HBOT, which is about oxygen, which is very beneficial, and very qualified staff members who provides speech.
Please give me food. Can we go for a shopping? That was after now the second shot. Before the second shot, she could do short call on her own, but long call support. But after the second one, she is fully trained.
1, 2, 3.
Every patient has a case manager who keeps in touch. I think in a month we get at least 2 calls for follow-up. I believe and I trust that NeuroGen, they know what they are doing.
If I talk about Dr. Arok Sham and Dr. Nandini, I'll first say, God to bless them. God bless these two doctors. And we tried just to give us small hope with the changes they did. Dr. Arok came, he told me, this girl in 2 years' time, she'll be totally a different girl. Believe me, today, it's exactly 2 years, because I was here 2021 November. Now it's 2023 November. She's totally a different girl.
Cranberry.
Orange.
Orange.
And make it
People who never saw Eliana, when she had all those funny behavior, they don't believe she was on spectrum.
My advice is stem cell. I know there are so many narratives about stem cell out there all over the world, and we are talking with a lot of confidence that stem cell works. Our daughter is different. She's a normal child now as a father. I believe and I pray and I trust that Eliana will grow to make positive child change to the world.
I believe Eliana one day will surprise us. Eliana is a gift from God.
So I want to show you what Ileana is up to today. This is 1 week back, Ileana.
Good night.
open. Open. It's open. It's
Ileana looks like she'll become a doctor, it seems.
No, we
So this is Dr. Who?
Eliana.
Eliana. So what is Dr. Eliana doing? Oh, checking temperature. How is Shushu's temperature? It's bad. Wow. So now, what next?
This is Ileana success story. There are so many such. And just wanted to share this very, very proud and emotional moment. No, can you make out? There is, she's like any other child. She's better. Look
No,
at.
check her tummy and the chest now. Yeah, the teeth are okay. The pressure.
Let me check it.
She has had enough doctor visits and she knows what needs to be done.
When you're giving her oxygen, she doesn't have oxygen.
Yes, see. She's giving her oxygen. Okay, this is a nice video. Anyway, cerebral palsy. This is a publication where we looked at brain damage. You can see these blue areas, severe damage, more damage than in autism. You can all these areas. After 6 to 8 months, you can see that they are starting to recover. So in cerebral palsy, it's a little more challenging because there's damage to the brain in terms of morphology or structure also, and it takes some time for the brain to recover as well as to reconnect and get physical as well as cognitive improvement. These are again all our publications in cerebral palsy, and when we combine, as I said, the cell therapy with integrative therapy, we find better improvement in all the different areas. So only with cell therapy, we find improvement in 55% in neck control, 61% in sitting balance, 46% in standing balance, walking balance, ambulation, like movements, and overhead activity. But with integrative therapy, the percentage is 5% to 6%, almost sometimes 10% better. You can see that in leg movements, almost 13% better when you combine with oxygen therapy. So on its own also, the cell therapy with rehab will give good results, but when you combine it, the results are much more. This is an example again of a child with autism, with cerebral palsy from Kenya. He came to us with completely wheelchair bound, with hand function affected. Understanding and cognition was good, and we found slowly after the treatment with good rehab that he's able to do a lot of hand activities, which we take for granted. Then standing with support, slowly walking with support, then eventually walking without support. So this happened over a period of, the first part happened over a period of a month, and this happened over a period of a year. Intellectual disability, just a fast glimpse of what we know as mental retardation. Again, publication, first ever publication from NeuroGen. I just wanted to give a comparison where we've done in this publication or paper comparison of only cell therapy with cell therapy, only rehabilitation and cell therapy with rehabilitation. So the blue graph is the cell therapy with rehab, orange is only rehab. So if you see that in those who have taken only rehab, 20% do not improve, 80% improve. In case of those who have taken cell therapy, there are nobody in the no improvement, and all of them have improved to various degrees. Now, what is the major difference that you see? Here you can see that in case of rehabilitation, most of the patients have improvement, but mild improvement, 37%. But in those who have taken cellular therapy, 62% show significant improvement. So that is the shift that you see. Only rehab will give you improvement, but you combine with cell therapy, the amount or quantum of improvement as well as the acceleration or the speed of improvement is much more. That's what I wanted to point out here. So this is a brain functioning, very severe brain damage and intellectual disability. This is after the dream. So there are no adverse events, there are no major adverse events, there is no major irreversible neurological deterioration seen after this treatment. Minor, there can be spinal headache, vomiting, local pain, some increase in hyperactivity for some days in a few children. In those who have a history of epilepsy or seizures, there is a 3 to 6% chance of having a seizure after the treatment. They reduce by 3% to 3%. Okay, we have Dr. Sharma also here to answer questions, almost finishing the presentation. So you're all in good luck here. Sorry, here. So less than 3% if we give proper medications. This we have published. Seizure as a possible complication, and so everything that we do we publish. All our work is done under the oversight of a institutional ethics board. And in conclusion, neuroimaging technology is giving us a lot of information about which part of the brain is affected in autism. Biochemical investigations give us understanding of metabolic pathways involved in autism. And new comprehensive multidisciplinary treatment is the way ahead for autism and cerebral palsy and other neurological conditions to improve quality of life as well as reduce the symptoms. This is a safe and effective treatment. To be noted, the cell therapy on its own is not a cure. It needs to be combined with conventional rehabilitation as well as other medical treatments. And as of now, it is still not a standard of care, but it is a clinical option. So all these our publications have demonstrated that it is possible to repair and regenerate brain and give functional recovery. We have treated over 16,000 patients from more than 100 different countries. And how NeuroGen is different. NeuroGen is the only center that treats patients purely with incurable neurological disorders. We use safe treatment, we use safe autologous cells, no cells from outside, no chemical mixing, cells from the patient's own body injected into the spinal fluid, directly reaching the brain. It is combined with a comprehensive rehabilitation and integrative treatment. We have been here for 16 years, treated over 16,000 patients from over 100 different countries. We have a combination of trained and experienced professionals across all specialties working together. We have the largest amount of scientific publications in the world to date, 111 publications. We are constantly writing books for professionals as well as parents, and we have written book chapters on various international books and textbooks. We constantly keep on researching the causes of why a certain condition happening, what more can we do. Our treatments continue to evolve, and our work is monitored by the government certified institutional ethics committee. So the best results are when you accept your child the way as he or she is understand what is happening with your child, work together as a team, understand that you have to have a properly devised treatment plan as well as a schedule for your child, combine newer treatments which work together with each other, that is cellular therapy with rehabilitation, work on the nutrient imbalance as well as work on the gut. So once you have decided that this is a treatment that you want to take, then you will be assigned a coordinator who will help you through the whole process, the logistics. We have a 1 week treatment and a 2 week treatment. The 1 week treatment starts on a Sunday, goes on till Saturday. The first 2 days is assessment, blood workup, understanding your child, explaining to you what your child is suffering from and what is the extent of the condition. The third day is actual treatment of the cellular therapy, and Wednesday to Saturday is a rehabilitation and as well as monitoring for any immediate side effects. The 2 week program also starts similarly, but along with the rehabilitation, we combine the integrative therapies which go on for about 10 days after the cellular therapy. And in addition to the routine rehabilitation, also added is the aquatic therapy on the second week. So these are the two programs, and these are two hospitals. All of you are most welcome to come and visit us. We love to have people over and for them to see the positive environment that NeuroGen brings to the lives of those who otherwise have given up hope. So welcome to visit us, and we are both here to answer your questions. This is your good chance to ask whatever questions you may have. So as I told you before, keep your questions ready. Pooja is asking, कोमल काटेचा गतिमत्वाचा भाग आहे, फिलिप्स फिट्स येतात, ते 30 वर्षाची आहे, तुला काय ट्रीटमेंट करावे, तिला काय ट्रीटमेंट. पूजा काटे is asking about a 30-year-old with intellectual disability who also has seizures. पूजा 30 वर्षाची आहेत आणि फिट्स आहे. फिट्ससाठी औषधं द्यावे लागतील, पण गतिमत्वासाठी किंवा मतिमंदासाठी ट्रीटमेंट जी मी आता सांगितली आहे, ब्रेन डॅमेजला आपल्याला रिपेअर करता येतं. तर तुम्ही आम्हाला संपर्क केलेला आहे, तर आम्ही नक्कीच तुम्हाला सांगू की कसे इम्प्रूव्हमेंट होतात. So for a 30-year-old ID with seizures, yes, seizures need to be controlled with medications, but cellular therapy with integrative and oxygen-based therapy and rehab can help improve the quality of life of this girl. पूजा, तुम्हाला जर समजलं नसेल तर परत मेसेज टाका आणि मी आणखी विस्तारामध्ये तुम्हाला समजवणार. Is there any right age group and medication can be taken up? Sanjay Sharma, could you please tell, can speech be regained if he is not able to speak since birth? So Sanjay Sharma, would you be able to tell us which condition are we talking about, autism or cerebral palsy? In autism, definitely there is good potential for a child to speak, even if he has not spoken from birth, unless the child has hearing deficit. If there is no hearing deficit, speech is possible. Somebody is saying, please speak in Tamil. As for Tamil பேச முடியும். ஆனா உங்களுக்கு ஏதாவது கொஸ்டின் இருந்தா நீங்க இங்கிலீஷ்ல எழுதுங்கோ, நான் தமிழ்ல உங்களுக்கு ரிப்ளை பண்ணுவேன். So I think Sanjay Sharma is asking about the right time for the cellular therapy. The earlier the better. Yes, sir? The earlier the better. So children who are less than 5 years do the best. The earliest child with autism that we have treated is 14 months old. In case of cerebral palsy, the earliest we have treated is about a year old. We have treated a spinal cord injury 8 months old. So actually quite early we can start. The weight has to be at least 9 to 10 kgs. So what is the amount of bone marrow aspirated? The amount of bone marrow aspirated depends on the weight of the individual or child. Children less about 10 kgs to 20 kg, about 60 ml of bone marrow. Children around 20 kgs, we would take about 80 ml. Those who are adult weight, that would be about 100 ml. So depending on the weight of the individual. To increase the harvest, we would stimulate with a granulocyte colony stimulating factor injection, which stimulates the bone marrow. We give 2 doses of that before the treatment. So one on Sunday and one on Monday. So this amount of bone marrow gives us very good yield. amount of cells injected back after separation. Is there any medication given before or after the procedure? So yes, as I said, before the procedure, we do the stimulation with GCSF to stimulate the bone marrow. We get the rule of thumb is body weight into 10 raised to the power 6. Minimum of this cells needs to go. So if a child is 20 kg, 2 into 10 raised to the power 7. So 2 followed by 7 zeros. That is the minimum number of cells that need to be put in. From our experience, since we stimulate the bone marrow, we get almost to 100 million to a billion cells. So good amount of cells are harvested. Naresh Pagaria is saying, my son is 26 years old with CP. Hope treatment can be successful as he is mild CP. Yes, mild CP, you will see improvement because in mild CP, generally cognition is good. So even at 27, 26, if you do good therapy after the cellular therapy, you will see improvement in your child. Stem cell takes blood and store and convert in millions, and after 3 weeks, but yours is different. Why and which is more effective? Yes, as I explained to you, we take the bone marrow. We don't take the blood. Bone marrow is the factory of the cells that we need. So it has enough cells, and once we separate, there is no chemical mixing. It is put fresh into the spinal fluid. Now, the spinal fluid around the brain and spine itself is the best laboratory of our body. The cells will multiply there, and we get enough. So you don't really need to keep the cells outside and multiply. So that is one thing. The other thing is this is a natural method. The example that we generally give is, do you want to give your child fresh orange juice squeezed right now and fresh made by mother, or do you want something which is preserved in the laboratory or preserved outside, like a orange juice which is preserved like a Tropicana or a Real? So fresh juice will always have the best nutrients. Nutrient loss is not there. So when you give fresh cells, there is no loss of cell. The cell viability is very, very high. Number two, there is no mixing of cells with other chemicals which are outside. And when you multiply, you may gather other contaminants or mutations. So all of these issues are negated when you take cells fresh and put them in the body. So with our process in the last 16 years, we have seen no side effects like contamination or infection or any problems when we use the child's or patient's own cells, with very, very good results. Is the treatment FDA approved? Why is this treatment not done in USA, Australia, and other countries and is done in India? If there's hope that autism can be cured, then why is this not being recommended by other pediatricians or doctors to go for this treatment? Okay, so why is this treatment not FDA approved? Is that what you want to say? So, okay, FDA is Food and Drug Administration. So what does FDA do? It controls food and drug. Cellular therapy that we are doing, specifically, which is autologous, taken from the patient's own body and put in the patient's own body, is not categorized as a drug, neither is it is a food. So FDA is actually not the regulatory body for this procedures or processes. In fact, there is a court judgment given in the US which says that surgical treatment has never ever been regulated by FDA and can never be regulated by FDA. So it doesn't come under the FDA purview. However, if you take cells from outside or you multiply cells outside, then it becomes a new drug and then it comes under the FDA purview. So the treatment that we are doing, which is autologous bone marrow derived mononuclear cells injected intrathecally, does not come under the FDA purview. Now, USA, in fact, in USA, there are different states, like the state of Texas, which has laws which does allow the use of autologous cells. However, because in the US, the whole science of regenerative medicine had taken a backseat about 10 years between George Bush regime to Obama regime. 10 years, the East went ahead, and we are much ahead of the US in the field of regenerative medicine. So even though there are laws which allows autologous cells in the state of Texas, they do not do it because they do not have the know-how. So the Western world, in fact, is behind Eastern world like China, India, Korea, Japan are much progressed in the field of regenerative medicine than the traditional West and Europe. So that's why people from all over the world come to India. If autism can be cured, then why it is not recommended by pediatrician or doctors? Because the conservative and traditional approach to autism is just rehabilitation. Uh, the rehabilitation therapists have a goal that you keep doing rehab all your life, and you see some changes, and after some time, parents lose hope. So rehab is the pillar for treatment of autism so far, because that's what they have learned. Pediatricians or doctors who have children with autism come to us for treatment, having looked at all the publications and data that we have. So there is understanding that it is possible to treat. However, what has come down from the Western world over a period of time is what is being followed through. Number one, that once the brain is damaged, cannot be repaired. That's a dogma people have had for a whole lot of years, and that is still fixated in people's brain. Number two, that autism has no cure except for rehabilitation. So because the conservative thought, it's taking time for people to understand and realize, and because the data is coming from the East, the Western doctors, or even doctors, even in our own countries, are still finding it difficult to accept. Most of the treatments or new modern medicine that comes or gets established or accepted comes from the pharmaceutical companies. Regenerative medicine, however, is much different, and pharma has no role in it, especially when we are taking the cells from our own body. And that's the reason that since pharma doesn't have a say in it, and in fact, for pharma, this is a disruptive medicine. Pharma is opposed to the advent or a future of regenerative medicines, and hence the conservative medical fraternity is still not up to taking the front for regenerative medicine. So there are many different politico-economic factors which come into play. However, the needle is shifting. When we started almost 16 years back, it was completely negative. Now it's come to neutral. There are pediatricians, even in the US, who do suggest patients saying, go to India. There is in fact, a pediatrician in Kenya who does tell when the child comes to him very young, tells them to go and, go to NeuroGen and do the treatment. So there is a shift, but because of fear of being, trolled or being questioned or being suppressed, they do not come out very strongly. But they do tell parents within the closed, behind the closed doors. Anything else you would like to add?
No, so in continuation with what Dr. Nandini said regarding that FDA, I'll just make it simple for you. In medicine, there are two things. There are procedures and there are products. So a drug, a tablet, an injection, or a vaccine is a product. What is a product? A product is something which is manufactured by a company and sold to doctors. That requires FDA approval. On the other hand, procedures like a bypass procedure, skin graft, or even the cell therapy procedure that we do is not a product. It is done in a hospital. And as per various Indian regulations, as per various court judgments in India and the US also, procedures do not come under FDA. So that's the distinction. It's a distinction between a product manufactured by companies and sold to doctors that requires FDA approval and procedures which don't require approval. In fact, if you go to the FDA for a procedure, they say, don't come to us. We cannot approve procedures. All right. Now, Dr. Nandini very well explained the reasons why it's not available in America, but there are very powerful forces. For example, the people most opposed to our work, are people who run rehabilitation centers. And I wonder, in fact, in India, 400 rehabilitation centers and therapists have got together to try to oppose our work. And I'm not saying it, they actually mentioned it in an article in the newspapers. And one has to question why. Why would they want to oppose this? Because there is an entire economy that is sustained on our children continuing to take rehab. In other words, as long as your child cannot speak, you will take speech therapy. The moment after cell therapy, your child starts talking, will you go to a speech therapist? Obviously not. And if you don't go to the speech therapist, who is going to lose economically? It's just, I'm not saying anything, it's just common sense. So obviously, their concern is, well, if all the kids get better, who will come to us? Now, surprisingly, and this is very, very interesting, if there is a therapist or a doctor, even pediatric doctors or pediatric neurologists, when their child has autism, they all come to us. So you will tell the patients, don't take it, but when your child or somebody in your family has it, you will take the therapy. I think just this, and we have several hundreds of parents who have had this treatment taken for them. So your views change depending on which side you are on. I think that will explain everything.
Yes, thank you so much, sir, for
Yeah.
that addition. So the other question is, are there any patients that have no improvement after this procedure? There is a small percentage depending on the age of the child. So children younger than 5 years, almost 97% of them have good improvement. 2 or 3% may have mild improvements. But if they are older, children who are 10 years, 15 years, 20 years, in them 10 to 15% of these may not show any improvement at all. My son is 8 years old, and what are the chances to recover if we start treatment now? The chances are very good. We see pre-pubertal children before puberty sets in is a good time to at least start the treatment. We have better possibility, almost a 90% chance that he will show improvement. Yes, you can ask questions. Praveen, is it advisable to go with HBOT around 3-year-old having history of myoclonic seizures? When there are active seizures, we do not recommend HBOT. Seizures need to be controlled for at least a couple of months. And once the seizures are controlled, then yes, HBOT can be done. So in active seizures, we would not recommend, because the machine in which the HBOT happens is a closed machine under pressure. And if the child has seizure inside the machine, it takes about 7 minutes for the pressure to come down to normal, and then only the door can be opened. So for safety reasons, we do not recommend HBOT during active seizures. But in childhood, if child had seizures and now it is controlled for some time, then yes, you can go ahead with the HBOT. Tulsi Kumar from Jharkhand, I have transverse myelitis since 2 years. Surgery has been done, but I didn't get any recovery. I have no sensation below D2. So generally, Tulsi Kumar, for transverse myelitis, what surgery has been done? It's a inflammation in the spine, which leads to damage. So it's a non-traumatic spinal cord injury. Cellular therapy can help you. If you do good rehab with cellular therapy, we have seen patients with transverse myelitis be able to stand and walk with support. Your level is a little high, so standing and walking with support is possible. Also, transverse myelitis, it's usually not a complete damage, so some amount of sensory recovery may also happen. But you have to do a very intensive rehabilitation after the cell therapy or cellular therapy, intensive rehab with hyperbaric oxygen. In 3 to 6 months, you should see a good improvement. Raghav, 15 years, behaviors are good, eye contact with simple sentence, listening and response. Expected improvements are zero, function with no thinking to appropriate age maturity, sentence like speech and basic understanding. Will it work? Yes. So in a 15-year-old, as you are saying that the social age or age maturity is low, as part of our clinical assessment, we do a detailed assessment along with the brain scan. The detailed clinical assessment tells us where in a social age he is at this point. So if he's 15 years old and his social age is like a 7 or 8 or 9-year-old, yes, you can expect improvement in terms of faster improvement in social age and maturity after the treatment. Whether he will reach his actual chronological age and social maturity will depend on what is the gap at this point. But it is possible to get him nearer to his social age, to his chronological age with the cell therapy. When will the Mexico center location open? Will cost be lesser than in India?
Well, it's not Mexico. Our center is opening in the Bahamas. Tentative date of release is either February or March of 2026. The cost has not been finalized, but it will be significantly more expensive than India. However, to those of you who are from America, it'll get compensated by the fact that you will not be spending on travel. So whatever you save on travel, well, it's likely that it will be that much more. But we are definitely starting. Myself, Dr. Nandini, Dr. Prerna, our whole team was there last week. The whole hospital, everything is finalized. So yes, we should be there in March of
2026.
2026. Yeah.
So, Malav, what is the difference of bone marrow to umbilical cord stem cell therapy? Malav, I did explain during my presentation. So, umbilical cord stem cell is cord blood is the cells which you get where from the cord which connects the child and mother. So when the cord is cut at that before around that time, if the blood from the cord is collected and then it is stored in minus 190 degrees centigrade in liquid nitrogen tanks, and it is mixed with a cryopreservative known as dimethyl sulfoxide. So this is stored cells, number one. Now cord blood is two types, the blood and the tissue. The tissue is cut and then it is multiplied in the laboratory and again stored. So again, one is multiplied cells and both of them are stored in cryopreservative. So when you take cord blood, it may be your child's cord blood or it may be somebody else's. When it is somebody else's, there are two possible issues which come. One, whether your child's body will be able to accept this because it is allogenic. It is somebody else's. So your body may not be able to accept somebody else's and there can be a reaction. This reaction is very, very strong, leads to a whole lot of problems, including shutdown of the different body parts. More importantly is that these cells are stored or cryopreserved. When you have to keep the cells alive in very cold temperature like minus 190 degrees centigrade, the chemical which is mixed with it will help keep the cell alive at cold temperature. But when it has to be infused in the patients, the temperature has to be like us, like normal body temperature. So from cold to normal when it comes, this chemical has to be completely washed off and only then you can put it in our body. Even a little amount which if it remains again causes a severe reaction in the body. Especially for brain conditions, when you cannot put these cells into the spinal fluid because even one drop of this dimethyl sulfoxide can completely damage the brain. So that's why cord blood is a good source for blood disorders like hematopoietic blood disorders like sickle cell anemia or thalassemia or blood cancer. But for brain conditions, they have limited efficiency because you cannot put them in the brain. You can use it as intravenous transfusion, and which I explained has limited efficiency because it has to travel a big path. So that's about cord blood. Bone marrow, on the other hand, is the child's own cells. We take it fresh, separate it fresh, and inject immediately. Viability 100%, no chemical mixing, goes directly to the brain. And that's the advantage of bone marrow.
Okay, if I can just summarize what Dr. Nandini said. Bone marrow is fresh, taken out and put immediately. cord blood is preserved for several months or years. Number one. Two, bone marrow has no preservative or chemicals. It's natural. Anything that is preserved will have a preservative. And the preservative which is used for stem cells is something called DMSO, which is toxic to the brain. It's harmful. Third, our cells are at room temperature, bone marrow, umbilical cord are frozen to minus several negative degree temperature. Fourth, our cells are injected directly into the spinal fluid so they reach the brain, whereas umbilical cord cells you cannot inject into the spinal fluid because it has got a preservative which is damaging to the brain. So you have to give it IV like a regular injection. So from there it goes to the heart, to the lungs, about 50% gets trapped in the lungs and then goes to the brain. So it goes in a via manner, right? So like Dr. Nandini had earlier said, the difference is bone marrow is like fresh orange juice. Take an orange, squeeze the fresh orange juice, whereas umbilical cord cells is preserved, frozen. And another important thing is that unless you have preserved your child's own cord blood, the umbilical cord cells are from, we don't know where they are from. The companies go to several nursing homes, they collect the umbilical cord and store those cells and keep it. So you don't know the source. So this is the broad difference. Okay, with that, I'm going to take a leave. I just wanted to announce something that all of you on this webinar will have a unique privilege. If you want to do a one-on-one virtual consultation with me or Dr. Nandini, this will be set up in the next week itself. Normally, there's a waiting list of about a month or so. So any of you want to do a virtual consultation with me or Dr. Nandini, we'll be putting up a number right now. You have to just WhatsApp on the number. And in the next week itself, you will get to talk to us directly. It's free of cost. The virtual consultation doesn't cost anything. And it's a privilege only to those people who are in the webinar. So we are going to put a number up soon and you please just WhatsApp on the number saying you want to have a virtual consultation. With that, I'm going to take your leave. Wish you all the best in the seminar. Great job, Dr. Nandini. Wonderful. Yeah.
Thank you, sir. So we continue here. There's another question about developmental delay, 2-year-old child, possibly due to neonatal hyperbilirubinemia, mild hyperintensities, bilateral basal ganglia. So this looks like a cerebral palsy, usually chorioarthroid cerebral palsy. Yeah,
Say that anybody wants to talk to me.
Sure. Yes. So this is chorioarthroid cerebral palsy. So yes, cell therapy will help. We don't talk about cure in neurological condition. We look at functional recovery. So yes, children like your nephew can have functional improvement in terms of being able to stand and walk and go to school and lead independent life. There may always be a little not spasticity but involuntary movements, but despite that, complete functional recovery is possible. But you start early, the recovery is much better. Since age is 15, will it be possible to get blood barrier? How it works? Yes, it is possible to cross the blood-brain barrier through the spinal fluid. So if we inject the cells into the lower spine, into the spinal fluid, these cells will go to the brain. That's how it works. I will be announcing the phone number in the end. So please wait till the end of the question answer session. Our baby is weight 7.5. How to increase the weight to start the treatment? Can we visit hospital to show reports? Yes, Vikasim, you're most welcome to come and show us the child as well as the reports. We can help connecting you to a dietitian who can help give you a treatment plan or the diet plan to help increase the weight of the child. But if the child has severe swallowing issues, then consider something known as a PEG, percutaneous enterogastrotomy. It's a small tube which goes into the stomach and you can feed the child from there and also from the mouth. This is a very safe process and it helps the child to gain weight so that we can do the treatment quickly. Ritvik, I'm 25-year-old living with spastic CP. Can cell therapy improve my condition? Yes, Ritvik, there is a possibility of improving your current condition if you work hard after the cell therapy. Yes. Rajesh Rajan's son is 19-year-old, is very hyperactive. Yes, 19-year-old hyperactive. It's challenging, it's difficult, but it's possible to take care. With the cell therapy, we do give some supplements which will help to reduce his hyperactivity. You combine cell therapy with hyperbaric oxygen, hyperactivity will also reduce. Understanding will improve. That's the main thing. Once understanding improves, all the other things will slowly settle down. Yes, Tulsi, your 28-year-old transverse myelitis, you are young. This is the time to push and get the improvement. Because as your body grows older, your injury becomes older, more difficult. So come at the earliest. Why few percent of kids not shown much improvement? Why improvement is less in speech? So some children don't show improvement if they are older, if they have very severe damage, if they have very severe epilepsy along with the damage, and if they have not done proper rehabilitation. If they don't do focused rehabilitation after the cell therapy, they may not see much improvement. Speech is the most difficult improvement to see, because if you think back, when you are born you don't speak, you start speaking at 1.5 2 years, so the brain needs to develop to that extent for the child to speak. Now in autism, the problem is not just being able to articulate. Many of these children sing songs, many of these children also say nursery rhymes, but they will not communicate. So it's not just about vocalization, it's also about language development, it's also about wanting to interact with other people. So speech is not just speech. Speech is very complex. So we have to improve comprehension. We have to create a need for speech. We have to ensure that the child likes to socialize, has interest in things. So all of things has to happen, then the child will speak and communicate. 27-year-old Ashik, what is the condition? The cerebral palsy or autism. Cure is not the word again that we use with these conditions. We can help in terms of functional recovery and ability to become better than what he is at this point. What is the difference between 1 week and 2 week? In 1 week, you have cellular therapy with 4 days of rehabilitation. In 2 weeks, you have cellular therapy with 10 days of rehabilitation and 10 days of hyperbaric oxygen and 10 days of ozone therapy. So it's an extended treatment with addition of oxygen-based therapy, which I showed you gives almost 6 to 10% better recovery when as compared to only cellular therapy. Since cell will be taking from hip bone, how can we say this cell will be good once, since he may already have defected or damaged cell? How it works? So why do you think the cells will be damaged? What does hip bone marrow do? The bone marrow produces blood. If your child's blood is good, if the hemoglobin is good, there is no cancer, there is no sickle cell anemia, there is no thalassemia, the bone marrow is producing good blood. So we should not really blame the bone marrow for the child's brain condition. What is the problem with your child? The brain is damaged or the brain is functioning less. The bone marrow has no problem. Liver is good, heart is good. Why do you blame the bone marrow? And we test, right? We test, do the blood test, ensure that the hemoglobin is good, which gives you indirect indication that there is no problem in the bone marrow, there is no infection. So what we are taking is taking bone marrow, which is a healthy bone marrow, and putting the cells in the brain. So there is no problem with the bone marrow. And we check under the microscope. Also, once the bone marrow is aspirated, cells are separated, the neuropathologist will check under the microscope. Post stem cell, is it really needed to do therapies? Yes. Very, very important. To do physical therapy, to do occupational therapy, to do speech therapy. What is stem cell therapy or cell therapy? What does it do? It improves the hardware of the brain. You saw on the brain scan, the blue areas which are functioning less, they become green, yellow, and red. But just improving the hardware is not enough. If you don't put the software, if you don't put the training, you will not see the improvement. Because the brain is like a computer, that the hardware is important. Right now, your child's hardware is not functioning properly. But once the hardware works, then you do the therapy, the same therapy you have been doing till now, it will give you better results. मला तुम्ही जी माहिती दिली ती पूर्ण मराठीमध्ये सांगितले. सांगितले म्हणजे सांगायचं की सांगितले. मराठीमध्ये जे आहे कोणती माहिती तुम्हाला मराठीमध्ये हवी आहे? Can integrated second be taken next week right after the first week? Yes, yes. It is done in continuation, Utpal. In fact, the 2 weeks after the cell therapy, from Wednesday itself, we start the integrative therapy. For those who are staying with us for 2 weeks, yes, it has to be done as near the cell therapy as possible because the combination is important. We do the treatment together, and that's why it is important to do as near the oxygenation will help improve the cells to function better. So the effect of the cell therapy will become better. With hyperbaric oxygen, how long does a child stay in the chamber per session? Maximum 1 hour per session. So you start with 30 minutes, then 45 minutes, then 1 hour. 1 hour in, so 1 hour to 1 hour 15 minutes is the maximum time the child will be in the chamber. And usually, along with the child, the parent will be there. What is the risk of paralysis? From bone marrow, no risk of paralysis. For spinal injections, or we call it the lumbar puncture, there is a risk of paralysis, but in 16,000 patients, having done over 25,000 procedures, we have not seen any paralysis because it is done by expert under proper medical care. So there is a risk theoretically, but practically we have not seen any paralysis happening. Kuljit Kaur, my child is 18 years with neither low nor high IQ, not able to study well. How are you? So for 18-year-old Kuljit, if you are in India, if you could get him here, we could do a brain scan, do a detailed assessment. And once we see the brain scan, we'll be able to tell you about, how much of that brain can improve. So we can improve the brain functioning, and that will help your child to improve in understanding and IQ and academics and general social awareness also. How many Indian success stories are there suffer from autism? There are a lot of Indians who come for treatment and success stories similar to. So whether is an Indian or African or Indians from abroad, the improvements would depend on the rehabilitation. In fact, in India, you have good therapies. So after the cell therapy, if you could do good rehabilitation, success will be there. So almost 90% success rate. How many cells are in? I did explain. Generally, from our experience, 100 million to a billion cells, mononuclear cells are inserted or transplanted. Namaskaram from Mohinur. Most welcome, Mohino. Thank you for attending. Is steroids administered? So there are publications which have shown that steroid helps in the cell's survival. So during the procedure, only one dose of steroid is given, injectable, one steroid dose for the cells to improve the performance of the cell. Have you a comparison of research on allo-ACT effectiveness versus auto-ACT effectiveness? There are publications. In fact, if you look at publications which are available, the allo stem cells are given intravenously, usually cord blood cells. How do we know? We have not done the study, but we would compare it with other people who have studied, and our results are better than their results. So all these publications are available. There is we could send them to you and you could study it. And yes, effectiveness of the autologous is better than allogenic. We are planning to give home HBOT after stem cell therapy. So what will be the optimal pressure home HBOT? Home HBOT, Mr. Patel, generally the pressure doesn't go above 1.35 to 1.4 because it is a soft chamber. If the pressure increases, the chamber will blow up. So whatever pressure you are getting, 1.3, 1.4, continue that. Just you can increase the number of sessions. Okay, so if you are advised 30 sessions, give 60 sessions. That is the advantage in home HBOT, that you can give multiple number of sessions, more than what you can give in a heart chamber. Vikasam, I'm afraid my limitation, I can't speak Telugu. I can speak Marathi, Hindi, English, and Tamil. That's my whole repertoire of language. So unfortunately, but you can get in touch with us, and we have Telugu translators in NeuroGen. Divya Teja, child 6.5 years old, booked for November. He has speech, only repeats what he say, but doesn't understand. No active communication, but seems to understand everything. He often appears like he doesn't want to speak and stubborn. Yes, Divya, that's the problem. Generally in autism, what is autism? Autism, or is self, ism is body. These children like to be within their own body, and that's why they don't want to come out. So you have to be able to make him socialize more, take him out more, ensure that he is amongst children and plays more. So cell therapy will help improve his expressive language, and you'll have to create the environment for him to be able to find a need to speak. Motivation to speak or need to speak is very, very important. Huh. 7 years old is autism? Is it too late? No, absolutely not. Can autism be cured with few settings? Rather than cure, we would say yes, it is possible to come off the spectrum. If the child is mild to moderate, it is more possible. If the child is moderate to severe autism, we can come to mild to moderate. 7 years is not very late, but if you are interested, do not delay any further. Yes, the child can be discharged on Saturday. Sometimes there is a small chance of something known as a spinal headache that may occur in some children. In that case, 1 or 2 days more may be needed. But generally, by and large, 90% of the patients, 95% get discharged on Saturday. Ravindra, what if hyperactivity increases on SCT? Yes, if it increases, yes, we are going to give medications. We will start with supplements like magnesium and paracetam ceticoline that will help to reduce the HBOT ozone is not in the first week. No, because in the first week you have only 4 days after the procedure, and 4 sessions of HBOT or ozone are not enough. So because the first few are only increasing in pressure, so you have to stay with us for 2 weeks to be able to get 10 sessions of HBOT, which are mandatory to get improvement. 1 or 2 or 3 doses are like prasad. It will not fill the stomach. So you have to give your child a minimum of 10 sessions at a stretch to see a impact on the brain functioning and stem cells. Yes, MTHFR report is done in NeuroGen. There is no damage to the spinal cord during the procedure. You will see improvements in 3 to 6 months. Minimum duration required of HBOT is minimum 10 sessions in a row. If depending on the age of the child, less than 6 years, maximum 30 sessions within 2 months. Above 6 years, maximum 40 sessions within 2 months. Autistic children will have weak bones. Who tell you? I need to see this. I need to see the publication or the scientific evidence for saying that they have weak bones. They are children who jump, who run, who don't sit in one place. How is their bone weak? No. Spine looks weak and he can't sit straight. It is not the mistake of the spine that your child cannot sit straight. The mistake is the tone of the muscles. Muscle tone is low. That is because of the cerebellum. So it's a misunderstanding, a misnomer. Bones are very strong. We have treated 6,500 to 7,000 autism children. As I said, the youngest child, 14 months. Is it legally appropriate? It's said not to try. I think Paneer, Dr. Sharma has explained very well, and I also explained to you. I hope this has answered your questions. We have pediatricians and pediatric neurologists who have brought their children to us. How can I assess? Kuljit Kaur, assessment is clinical. The psychologist will sit with you, ask questions, look at your child, see what he can do. That is one way of assessing. The other is doing an MRI and a PET scan. So if you bring him to Mumbai, we will do the assessment. My daughter is 18 years old, has delayed milestone learning difficulty, the mood swings, very anxious about the future. There's Kritika, I hope you have attended my webinar. We'll send you the video also. I explain the complete way of how the treatment is done. Process and cost will be explained to you by a coordinator who must already be in touch with you. Will get in touch with you also. We will need to assess your child to see what really are the problems apart from anxiety. If she has low understanding or comprehension, we do a PET scan, and that can be treated. Yes. What is the price, both with rehab and without rehab? No, there is no session without rehab. 1 week treatment is compulsory, which will have rehab. The 2 week is something which you can decide whether you want to take or not, but highly recommended based on the results which we have analyzed. The treatment cost and logistics will be given to you by your coordinator. This is a purely academic medical webinar, and I will be talking only about the medical part of the treatment. Patient age 14 can't walk due to muscular dystrophy. 14-year-old muscular dystrophy can't walk means he stopped walking. Muscular dystrophy is a degenerative condition. Yes, the child can be treated. However, the main aim would be preserving his upper body muscle strength and breathing. So a child who has stopped walking and has leg deformities, difficult to make him stand and walk. If he has stopped walking recently, we can make him stand and walk with support. From the father of the child, no, we are doing autologous. We take cells from the patient's own body, because even if it is father's bone marrow, the child's body will reject it. So you will get more negatives than positive, number one. Number two, a child's bone marrow is stronger, has more cells than the father's bone marrow. So your child's bone marrow is better for him than your bone marrow. 6 years with delayed speech, no hyper, no epilepsy, behavior improved since we started speech OT, very good. However, no development in speech. There is good possibility of speech coming in this child with cell therapy and hyperbaric oxygen, as well as now we have added supplements. We see good results. Yes, as compared to other issues, speech and communication are usually the last to develop, but 60% is not a bad statistics. So with the combined treatment or comprehensive approach, the improvements continue to happen. Also, you must understand that when you do assessment, if your child is 6 years old, we also need his understanding may be good, but is it age appropriate? That's very important. So not only speech is a speech problem, it's also a problem of expressive language and receptive language. So we cannot really filter or dissect one from the other. It is a combination development, overall holistic development. So 6 years is a good age, but if you come at 12, 13, 14, it will become more challenging. So 3 years, Marco, it's a long gap. I would recommend a 2 weeks treatment. Do come, we can do a detailed assessment, how much the brain has improved, how much the child has improved, so that we can guide you further. I would recommend strongly the 2 week treatment for your son, Marco. Hemorrhagic stroke, 2023. What's your view on? So how old is your father? What is his current condition? Depending on his medical status, after hemorrhagic stroke, it's almost 2 years. That means the brain is now, whatever development or spontaneous recovery it had to happen has happened. So brain functioning can definitely be improved. How much he will improve will depend on what is his medical status and how much rehab you are able to do. So our studies do show reasonably good results with hemorrhagic stroke also. My daughter is 3 years old in December. She had a seizure after 10 days in a NICU, diagnosed with CP, weighs only 8 kgs. Doctor, yes, as Dr. Sharma said, doctors are against because they have not really studied our data. If she doesn't have seizures now, it's worth doing cell therapy, but you have to work on improving her weight to at least 10 kgs for the treatment to be effective for her. You can work on the diet. Ask your doctor, if not cell therapy, can you at least do PEG? So PEG is important. PEG helps the child to gain weight. So if a doctor says no peg, then I would say he's a very antiquated doctor. You have to be able to give options to your patients to improve their quality of life. So at least try the peg making. मुझे अपनी बेटी का ये ट्रीटमेंट करवाने में डर लग रहा है। चंदन, किस बात का डर लग रहा है? डर क्या है ये बताएंगे? तो डर सही है या वाजिब है या नहीं है, ये हम बोल पाएंगे। डर किस बात का है? We don't do LOSCT, whether it's effective or not. More than that, it is not safe. That's why we believe in going to the brain and injecting allogenic cells into the brain is not safe. For us, safety comes first. Second, about effectiveness, allogenic cells, the results are not as good as our treatment. So that's why we don't do. If somebody shows us that allogenic cells have better results than our treatment, our autologous, then we will consider it. Show us scientific publications which show that allogenic cells are better. We're having twin, having autism, one has mild, other is moderate, recommended to get treatment at the same time. I think you should do treatment for the same time because for both of them, the time is going. So it's better to do treatment for both of them together. Do you provide comprehensive plan, nutrition, PTOT? Yes, we do give complete rehabilitation plan. We give home program. We give diet plan. Yes, Nidhi. Consider gut microbiota could be disrupted if proper diet is not maintained. So the gut microbiota, it's not just the diet. First, we also have to look at what is wrong with the gut microbiota. If there is anything wrong, and that needs to be treated with medications. So yes, diet has to be good. Probiotics have to be given. Roughage has to be given. So we'll give you a diet plan along with the complete treatment. Mujahid says, my nephew's had first shot completed. Time gap, that time is finding gap. Can I take a second after 6 months? Should we wait? Mujahid, there is no gap in the hip. There will be no gap in the hip bone. You will not even see a mark. How there is no, so you can do after 6 months. You can between 6 months to 9 months also you can treat. There is no gap in the hip. Behavior and hyperactivity possible to recover. A few days back I shared. Okay, Mardanda Kishore Rajhans. I will ask my colleagues to, yes, it is possible to recover, but definitely 8 years hyperactive. The prognosis as compared to a younger one would be a little more delayed. So it would be challenging. How can you assure that procedure only sends cells to brain, not to other parts? I'm worried about exposing cells to other healthy body parts and overloading on other parts. How do we ensure that is the way body is made? Cells put into the spinal fluid will go only to the spine and the brain. It will not go anywhere else. When you put IV, in fact, that's where it will go to all parts of the body. So there is, because it's a closed place. The brain and spine is enclosed with coverings. So it will not go anywhere else. Logically, rationally, there is no logic to thinking it is going to go anywhere else. We've been doing this for 16 years, and this is well studied phenomena. So nothing to worry about. I can assure you 100% it's not going to any other parts of the body. Is it ICMR approved? Approved by whom? Do you have approved for ALS? I think if you were here for Dr. Sharma's answers and my answer, ICMR does not look at is Indian Council of Medical Research. It looks at medical research. It does not. It has in fact taken a back seat from stem cells, so it doesn't come under its purview. Who approves it? Institutional Ethics Committee, which is registered with the CDSCO, monitors and approves it. ALS, yes, we do have the approval from our Institutional Ethics Committee for ALS as well. In autism and gene is affected, bone marrow aspirated. Number one, can you confirm to me whether gene is affected? Number two, even if gene is affected, the gene affected is affecting the brain development. It is not affecting the bone marrow. Bone marrow is producing good blood, isn't it? As I said, if the child had gene affecting blood issues like sickle cell anemia, thalassemia, then you cannot use the bone marrow. So your child is someone who has a brain problem. For example, if there is a child who has a hole in the heart, will you say the bone marrow of that child is not good? No, it's just the heart problem, like that is the brain problem. Even if it is a gene affecting the brain problem, it is a neurodevelopmental condition. That is when the brain was developing. At that time, the gene has affected the brain. This gene will not affect the bone marrow. So bone marrow cells are safe, healthy. They are not influenced by the genetic issue your child's brain condition may have. If we have done HBOT recently, should we delay the stem cells as we saw stem cells for with HBOT? You can do, but give a 1 week gap, because it's not the stem cells which are the problem. When we do a brain scan, the HBOT affects the brain scan. It shows very different results. So that's why you give a 1 week break after HBOT before doing the cell therapy. 6-year-old, chances of improvement are good. As I showed the results, 90% chance she will improve. Explain treatment for cerebral palsy and rehab procedure. After Ritvik, I have explained the treatment procedure is the same for cerebral palsy or autism, which I had explained before. Rehab afterwards will be physiotherapy, occupational therapy, depending on where the child is, speech therapy. So the process per se, whether it's cerebral palsy or autism or intellectual disability, it's in the brain. The cells will go into the spinal fluid. Bone marrow is aspirated for all of them. Brain scan is done for all of them. Now, in muscular dystrophy, apart from injecting cells into the spinal fluid, we also inject the cells into the muscles. That's the difference with muscular dystrophy. That is the additional part. My father, Sanjay Kumarji, balance and spasticity. Yes, we know doctors do not recommend it, but after some time, they do not give you any way ahead also, right? So you will have to make a decision for your father. We understand it's not easy, but that's why we are here to help you make that decision. Balance improves, spasticity will reduce. So I think it's a good chance you must give for your father to improve. Cord cells more potent than bone marrow? Maybe. Just the age of the cells is different. Theoretically, yes. Practically, feasibility of use is important. Can we use cord blood every time without, and do you have cord blood saved? Can you put it in the brain? Those are the questions. So theoretically, maybe the cells are more or they are more potent, really. At least the publications do not really show that. Sarah Osman, we are coming to the Bahamas, which is a Caribbean island near the coast, east coast of US. That is about an hour away from Miami. Will be establishing our center in Nassau, possibly in February or March. Govinda Haldar, 10 years old, has 10 to 15 words, understand, follow command. Can he have recovery? Yes. Yes, he has good chance since he already has words. He will have improvement in understanding, learning, comprehension, better following commands. Yes, Govinda. 3.4 was born with tetralogy of Fallot, has surgery, cardiac arrest, hence brain damage. 3.5 second and final heart repair surgery is done. Cardiac weight is perfect. Now neurological is a CP child. Yes, it is a good option. If your heart is good and you've got a clearance for minor sedation anesthesia, then yes, cell therapy is a good option for him along with hyperbaric oxygen. राघव गोस्वामी सफरिंग फ्रॉम मस्कुलर डिस्ट्रॉफी राघव गोस्वामी की प्रोसीजर जो है सेल थेरेपी, हम कमर की हड्डी में से बोन मैरो निकालते हैं, उसमें से सेल्स अलग करके कुछ हिस्सा पीठ के पानी में, कुछ हिस्सा उनके हाथों के मसल्स में, पैरों में इंजेक्ट करेंगे। आपने कहा कि उनका चलना बंद हो गया है, तो चलना बंद हो गया है तो पैर भी मुड़े होंगे, तो हम उनको खड़ा करके चला नहीं पाएंगे, लेकिन उनका जो धड़ और हाथ जो वीक हो रहा है उसको हम और आगे खराब ना हो ये कोशिश करेंगे, और उनकी जो ब्रीदिंग प्रॉब्लम है उसे ठीक की जा सकती है। तो मस्कुलर डिस्ट्रॉफी में हमारा मेन उद्देश्य होता है प्रॉब्लम बढ़े ना, और वो कहीं ना कहीं रुक जाए, ताकि इनकी जिंदगी या सर्वाइवल जो है वो बढ़े। Once child acquires skills in speech after cell therapy, there will be no regression. No, there will be no regression in the future unless there is very, very severe illnesses with high grade fever, or if there is emotional trauma, then there can be a little regression. But otherwise, we have not seen regression once the child has achieved speech. Okay, Malanu, we will get in touch with you. I'll be putting up the contact number soon. Please message also. Yes, I will be sharing the contact number. How often do we have this webinar? But I think we met yesterday. This webinar, we'll see. But you can see all these webinars. You will be seeing these webinars on our YouTube channel also. And I do Instagram live. Please follow NeuroGen Instagram page. And I do Instagram live every Wednesday as far as I can, unless I'm traveling. So at 5:30 p.m. India time, I do Instagram live. I'll be happy to answer any questions there too. If you're coming from overseas, you stay with us for 2 weeks. Post-treatment, there's 10-day rehabilitation. After that, we give you a home program, which you continue back at home. There are some people who come from overseas and stay back in India outside the hospital where accommodations are available for a few months for rehab also. So there are multiple options. Speech is on demand basis, language is missing, thinking, understanding is low. Yeah, so thinking, understanding, learning, comprehension has to improve, then language has to improve. So it is a process, it will take time, but it is possible at this point. Rabindra. अच्छा, चंदन अग्रवाल, आपकी बेटी को cerebral palsy है. Okay. Cerebral palsy, so if weight is 10 kgs and more, आप ला सकते हैं, डरने की कोई बात नहीं है. In a decade or so, we can expect more effective treatments for irreversible. This is one of the most effective treatments, Ritvik. And yes, new treatments and new innovations keep coming. So that's how we have innovated over the last 16 years, right? Where from doing only cell therapy with some rehabilitation, we have come to a whole process which has added, where we have added on hyperbaric oxygen and ozone and all that. And yes, newer treatments will come coming. But do you want to wait till then for your child to have treatment? What is available now needs to be consumed first, and whatever treatments happen later, you can continue to add them. माझी मुलगी नॉर्मल आहे, प्रॉब्लेममुळे शिक्षण नाही. कोणत्या ट्रीटमेंट कराव्या आहे? वर्षाची आहे, 33 प्रमाणात झोपते, ऍक्टिव्हिटीज काही करायला लागत नाही. पूजा, पूर्ण पहिले माहिती आणि असेसमेंट करावी लागेल, त्याच्यानंतर सांगता येईल की काय ट्रीटमेंट करता येईल. Is it 10% you can give guarantee child will be out of sector and will start speaking? And nobody can give guarantee about our own life, isn't it? But based on the age, and it's not my guarantee, it is based on our scientific data and analysis of having treated so many patients, children less than 5 years. There is almost a 95% chance of having good significant improvement. About 30 to 40% of mild to moderate come off the spectrum. Those who are older, the chances of coming off the spectrum are slightly less, but they can become functional, independent individuals who, despite or because of their autism, have done great things. So yes, there is a great possibility, but the onus is not only on us. We will improve the brain functioning, but you have to do the training and therapy. If you don't do the programming the brain will take the virus. So it's important that it's a combination. You and us together have to do the treatment. And yes, together we can get the child off the spectrum. Stem therapy जरूरी कुछ भी नहीं है. Seizure, हाँ, if there is a history of seizure, then there is a 3 to 6% chance that seizure may get stimulated. But medications can help to control it. Those who have uncontrolled seizures, in them we do not do the treatment. We wait for the seizure to become lesser. Yes, for 6-year-old with autism, ADHD, and learning issues, yes, you can go for cell therapy. Yes, a 7 years autistic child can speak, but it will take 2 to 3 years to reach that stage. So yes, but it is possible. For those who have had seizures as an adult, for only seizures, no stem cell therapy is not done. If you have intellectual disability, cerebral palsy, autism with seizures, then those conditions can be treated. Cell therapy is not a treatment for epilepsy. FRRA not in NeuroGen, but there is a company which provides this in Mumbai at this point. Nirman is the company where FRRA can be done. Post-treatment after 1 week, what needs to be explained? Not sure what you mean. After the treatment, your therapy is 10 days of rehabilitation, 10 days of hyperbaric oxygen, and 10 days of ozone therapy. How often is the therapy recommended? Depending on the extent of the problem in the brain. Sometimes one treatment may be enough. On an average, two to three treatment over a period of 2 years. So at least a 6-month gap between first and second treatment. Spectrum level 2, 4-year, 10-month. Delay in speech, stimming, gut tissue, 15 months, high fever with seizure. After that, no issue. Yes, very much eligible, Rakesh. We will give anti-epileptic cover, however, for 6 months with the treatment. So yes, 4 years, 10 months is a good time. Suggest not to delay too much. Just 1 week gap, Anurisha. So stem cells are not injected into the spinal cord. They are injected into the spinal fluid. That this fluid is actually roaming all around the brain. It's like a shock absorber. It gives nutrients. So the cells will go with the CSF to the brain. No side effects of PET scan, no. Dystonia has reduced after cell therapy, yes. It takes a little time, but dystonia has reduced. Yes, we have a institutional ethics committee which is approved by the CDSCO, and this institutional ethics committee has approved our processes. CP case with high hypertonia can we treat? Does hypertonia reduce? Hypertonia means you mean spasticity? Yes, spasticity reduces. It takes a little time with cell therapy, with good rehab and aquatic therapy, spasticity will reduce. CP since 2 years. Would you suggest medicine or therapy? Yes, you have to do rehabilitation therapies. Medication depends on the what is the condition, where if there is spasticity or tightness, what is the problem, and okay, then therapy. If 2 years could, you can do cellular therapy. As per the New Drugs and Cosmetic Act, stem cell therapy, no. As per the New Cosmetics Act, the stem cells are divided into 2 parts: products, as Dr. Sharma explained, stem cell products and cellular therapy. Stem cell products are those, cellular therapy are those where cells are taken from the patient's own body, minimally manipulated and put back. For that, ethics committee, institutional ethics committee, which is registered with the CDSCO, their permission is required. If it is a stem cell product, then you need to go through the clinical trial. We took HBO therapy, but hardly find any change. Yeah, it has to be combination. If you do HBO separately, cell therapy separately, rehab separately, you will not get a good combination. So you need to have a combination therapy. You need to do it together. Praneeth, in severe autism, depending on how much the brain is damaged, you may need 2 to 3 treatments over a period of 2 years. The minimum period is 1 week. The first time we recommend a 2-week treatment. The second time it would be 4 to 5 days minimum or 2 weeks. So it won't be 1 week and 2 weeks. It would be 4 to 5 days and 2 weeks. Every time there would be a gap of minimum 6 months up till a year gap. Difficulty in reading, less concentration, eye contact less, but loves writing, but not relevant. Yes, that means that her understanding and comprehension is low, Mukesh, and so cell therapy will help. We have treated, Dr. Virya, many patients from Kenya. I'm sorry I'm still in the webinar and couldn't speak to you. We have treated many patients. In fact, I did present a video of a very beautiful, sweet girl who is now off the spectrum. And I would be happy to connect you to her mother. Limb girdle muscular dystrophy. For limb girdle muscular dystrophy, again, it's a muscular dystrophy, which is a progressive condition. The muscle you can improve a condition with cell therapy and hyperbaric oxygen therapy. It is not, our treatment is not a cure, because limb girdle muscular dystrophy is a genetic condition and it is a degenerative condition. Aim of the treatment is to slow down the deterioration, stop or stabilize the condition of the patient. Yes, this will be sent to you. Whoever is attending this webinar, the video recording will be sent to all of you. Yes, anesthesia is given during the brain scans also, because the child will not lie stable inside the machine. So yes. Virtual autism, baby is fully recovered, only concern about echolalia. She's just 2 years. So wait for some time, 2-year-old, if you, there is nothing called virtual autism. Just you give a lot of stimulation. 2 years, she's still developing language. If you have a possibility, you can come here, we can assess for red flagging of autism. So in a 2-year-old, you have to do clinical assessment and you will have to do a brain scan. Then we will know whether really the child has autism or these are just few features. And with good stimulation and lot of, avoiding the screen time, you may be able to get your child back. Those who have ear infection, active ear infection, cannot take hyperbaric oxygen, but old ear infections, if it is healed and if it is completely treated, cured, then hyperbaric oxygen can be taken. Such children need proper ENT checkup before taking HBOT. Now, Samir, we are not currently visiting Kashmir. That is not in the plan. We can do a virtual online consultation, but at this point in this year, at least, we don't have program for coming to Kashmir. Okay, on this note, I am going to put a message. Where should I put the message? In the chat box. I'm going to put a message in the chat box so that with the phone number. The phone number is 90 plus 919090333336. Please, all of you, check this phone number plus 91. Sorry, I forgot the plus. So plus 919090333336. I'm going to put it again. Plus, where's the plus? Sorry. Plus 919090333336. This is a number where you will message for consultations. Okay, this has been a marathon for me, at least. Okay, I hope it has been useful and I have answered most of the questions. You will get the video recording of this once it's edited and made properly. And we hope to see you soon.